Actually in the Children's Emergency Department today, talking with Dr. Hagney, who's a hospitalist with children's, about bug bites. I think we're going to start with mosquito bites. We might get into ticks and we might get into stings as well. But as always, ask us your questions. We want to help you out because our kids are outside and they're playing all the time.
Yes.
And it's wet and it's humid now and it's full summertime. So send us your questions if we can do anything to help. First, I want to touch on too, you're here at Children's, but where else are you based as a hospitalist?
So I actually work over on the Illinois site too. We have a memorial site in Belleville and then also in Shiloh.
Okay, so Children's not too far away for our Illinois friends, myself being one of them. So I guess let's start out mosquito bites, kind of in this realm of things.
Mm-hmm.
So first line of defense, I think we all assume bug spray. Is bug spray safe?
Yeah, so there are several different types of bug sprays out there, and it can be kind of overwhelming if you don't know what you're looking for. So I think the first thing to know is that bug sprays work because they have this active chemical in them that helps to repel the bugs away. And because they have this active chemical in them, they actually have to be registered with our EPA. And that means they've been tested for their safety and for their effectiveness.
Okay, two very important words, safety and effectiveness, I think, when we're looking at stuff like
Exactly. And so probably the most common active ingredient that we use and are aware of is DEET.
Okay.
And that one's been around for decades, and it's actually effective with mosquitoes and ticks and several other bugs out there. So that's good to know. The one thing I will throw out is that I wouldn't recommend using it on any kids 2 months or younger.
Okay, so our little bitties going outside. Okay.
Yeah, exactly.
Anything we can do for the little bitties other than probably keep them inside?
Yeah, so if you're headed out with a stroller or pumpkin carrier, you can consider using like a mosquito net to cover, and that just creates a barrier between them and the outside bugs.
Maybe teepees. Super fun.
Yeah, exactly.
That makes a lot of sense though. And it's so when we're applying the bug spray to our kiddos, they're usually pumps or sprays. Anything we should keep in mind when we're coating our children?
Yeah, so before you're even coating them, maybe we need to think a little bit about what product you're using for the DEET, because products vary significantly with the amount of DEET in them.
Okay.
So what you're looking for is a product that has between 10 to 30% DEET.
10 to 30% DEET for our kiddos.
Yes. So anything more than that is not providing you any extra protection.
Interesting.
Actually is not recommended for kids any more than 30.
Okay, so maxing out at 30. I think that's super helpful and very important because I think we can all get a little weirded out sometimes of like, I don't want you to get all these. I don't want you to get bitten up, but I
also don't want to put these
coach you in this stuff. Okay, that's great to know. How often should we be reapplying bug spray? So thinking like people are going camping in the summer and things like that.
Yeah, so that's actually a good question too, and it's going to depend on what product you're using as well. So kind of going back to those just different percentages.
Okay.
So if you're buying a product that just has 10% DEET in it, it's only going to last about 2 hours for coverage.
Okay.
But if you have a product that has maybe 24% or closer to the 30, it's going to be lasting about 5 hours.
Okay.
And then the other thing you have to think about is what activities are you doing outside? Are you sweating a lot? Are you swimming? Because that's just going to wash some of that bug spray and protection away.
That makes total sense. Are there times of the year, times of the day even, where we should think about bug bites more than others?
Mosquitoes are definitely more active kind of when the sun is setting and rising, so just be aware of that.
Okay, so campfire time.
Yep.
Time to lather up your legs and arms. I guess that's a good question too. What body parts should we be thinking about? Should we do a child's chest? Should we do their face?
So really, it's just recommended to apply it to the skin that's exposed.
Okay.
And then you can also do the clothes as well.
Okay.
And absolutely, when it comes to the face, we gotta be careful, okay?
Yeah.
So never let a kid put the bug spray on themselves. Gotta supervise them.
I like this
And
idea
then,
very much.
And then when it comes to the face, you should maybe just spray it in your hand, and then you can kind of dab it around their face. You want to make sure to avoid the eyes and the mouth.
Got it.
And then just also be careful if they have any open cuts or wounds or irritated skin. You don't want to make that worse, so keep that away as well.
That makes sense. Let me think. What else do we want to talk about? Okay, so you get bit. It's probably inevitable that your kiddo is going to get a mosquito bite. It's summertime. they're supposed to, right?
Yeah.
What do we do? How many mosquito bites is too many? And what kind of reactions are not normal, I guess?
Sure. So there's really not a number that you can put on too many.
Yeah, you start to see a kid with
You're going to see them pop up. They're going to be itching more and more. There's really just not this magic number that is too many. I think the thing that probably worries parents the most is when the mosquito bites are significantly big. And so it's just important to know that when you get a mosquito bite, the itchiness, it kind of starts about 20 minutes after your bite, and then each child is going to be different. Some children have this hypersensitive reaction where the bite becomes quite large, and others are smaller. There's not a whole lot to do different for these large ones, but I do understand parents can become quite concerned if they're by the eyes or on the face. And if you're ever concerned, I will call your pediatrician and have them checked out for that.
Yeah, we have friends that they have, it's almost like an allergic reaction to them, and they're, it just
eyes are so puffy.
He got one like right in the corner of his head, and it kind of, it made his eyes fall shut, and we were all like, oh, what'd you bump your head on? He's like, it's a mosquito bite. It felt so bad for him. So we've talked about, kind of want to bounce back to, we talked about the chemicals and the store-bought brands. What about home methods? What are your thoughts? Where does that fall in protection?
Sure. So there are some products out there that are considered more natural bug sprays. Okay. They have products in them such as like cedar or geranium or maybe peppermint oil, soybean
I've heard
oil.
Lavender.
Yeah, things like that.
Our neighbor planted a ton of lavender in their yard, which I very much appreciate because I like to think that I'm reaping the benefits of that situation.
Absolutely. So, generally these products have been tested for their safety in certain concentrations, but the effectiveness of them really hasn't been tested. So that's one thing to remember. And when it comes to homemade products, we really don't know exactly what's going in it and what concentration. So that we really can't make any recommendations on. I would stick to the store-bought registered products that we know how they
with
work.
The safety and effectiveness of the D in there, with the scale that we talked about. Appropriate and safe for kids.
Yes. And the reason that we're such supporters of using, the products that we know that are going to be safe and effective is because there are situations where there's lots of mosquitoes around and lots of ticks around if you're going camping or hiking, and these insects and bugs, they do carry some diseases that can be spread.
Is there anything we should think about when our kiddo gets bit? It's normal standard bite, they're scratching. Is there anything we can do to relieve some of that itch?
Oh yeah, absolutely.
So easy to rationalize with an itchy 3-year-old. So what can we do?
That's the worst, right? So there's a few things that you can do. So a topical hydrocortisone cream that you can buy at any pharmacy or grocery store, or calamine lotion are both great options. You can put those on about 3 to 4 times a day. And then if that's just not cutting it, you can actually use an oral antihistamine like Benadryl. And just make sure that you're using an age-appropriate dose.
The dosage, which you can also get.
Dr. Horst,
troubles with the emergency department. Which you can find through your pediatrician for that dosing table or aspirin. Okay, got it. Let's see, what else? Make sure you ask us your questions, guys. I don't camp, so if you've got them, let us know. Let's see, we talked about babies, we talked about the bigger kids. Should we touch on ticks real quick?
Yeah, let's talk about ticks. We're always seeing a few visitors that we need to pull them off of. So if you live in an area where you know there's ticks, or you've been out camping, hiking, you're definitely at risk to have some. And these guys, they like to hide. So they like to hide behind the ears and the scalp and in like little crevices like the armpits, behind the knees. So at the end of the day, make sure that you're checking your kids when they come in. If you do find one though, we just need to go ahead and take it off of them. And to do that, you're going to need a tweezers. And you can just grab it right at the head of the tick, next to the skin. You're going to want to pull kind of firmly upward. And sometimes these guys hold on for a while. They don't let go right away. So it could be a minute. And then after you have the tick off, just make sure you got all of it and then clean it up with alcohol.
Okay. There we go. And so if we get a tick bite, we remove it. Anything we need to watch for after a couple of days or anything like that?
There is expected to be like a typical bug bite. There's going to be a
little
little
on it.
Yeah, there's going to be like a little area of redness, and it's kind of firm sometimes as well. And tick bites can actually like that spot can actually
Yeah.
last for several weeks
Okay.
before being totally
Okay.
healed. But if you're seeing spreading redness or you're concerned that it's getting infected, that's absolutely an appropriate time
Time to call the
to call
doctor.
your doctor.
Makes sense. Guys, have so much fun outside and don't get bit up. We will continue our summer series next week, and we look forward to hanging out with you then. Thanks so much.
Bye.